Most people think controlling blood pressure means one thing: lifelong medication, pills in the morning, pills at night, and a quiet belief that this is just how life is now. But here's the truth: no one really tells you. Your body already has a built-in system to lower blood pressure naturally. No prescription, no cost, no side effects. And it works within seconds. After spending years observing how the heart behaves under pressure, one thing becomes very clear: your blood pressure is not just about your heart. It's about your nervous system. Let me explain this in the simplest way possible. Your blood vessels are not rigid pipes. They are living, flexible tissue. When you're young, they expand and contract easily. Blood flows smoothly, but with age, they stiffen. The walls become less elastic. Your heart has to push harder to move blood through your body. That's one side of the story. But there's another side that most people completely ignore. Your nervous system. Think of it like a car. You have an accelerator and a brake. The accelerator is your stress response, your fight or flight system. It tightens your blood vessels, increases your heart rate, and raises your blood pressure. The brake is your relaxation system, your restand recover mode. It slows your heart, relaxes your vessels, and lowers your pressure. Now here's the problem. After 50 or 60, most people are driving through life with their foot constantly on the accelerator. Stress, poor sleep, worry, noise, screens. It never really turns off. And over time, your brake system becomes weaker, simply because you're not using it. Medication helps control numbers, and it's important, but it doesn't teach your body how to use the brake. That's where breathing comes in. Because every time you exhale slowly, you send a powerful signal to your brain. We're safe. You can relax now. That signal travels through a nerve called the vagus nerve, one of the most important pathways in your body. And within seconds, your blood vessels begin to relax. Your heart rate slows down. Your blood pressure starts to drop. This is not motivation. This is biology. So the real question is, how do you activate this system on demand? Today, I'm going to show you 3 powerful breathing techniques. Each one has a specific purpose, and together, they form a complete, natural system to help manage blood pressure. Let's start with the first one. This is called the 4-7-8 method. Think of it as your daily reset button. Here's exactly how you do it. Sit comfortably. Keep your back supported. Inhale quietly through your nose for 4 seconds. Now hold your breath for 7 seconds. Then exhale slowly through your mouth for 8 seconds. Long, controlled, and steady. That's 1 cycle. Do 4 cycles. That's it. It takes less than 2 minutes. This technique works because the long exhale activates your relaxation system, while the breath hold slightly increases carbon dioxide, which helps your blood vessels relax. Do this in the morning, do it in the evening, or right before a stressful situation. Within a couple of weeks, many people notice a clear drop in their readings. Now, let's move to the second technique. This one is called resonance breathing. And this is where things get really interesting. Your heart doesn't beat at a fixed rhythm. It naturally speeds up when you inhale and slows down when you exhale. This variation is called heart rate variability. Higher variability means a healthier, more adaptable heart. And research shows that when you breathe at a very specific pace, your entire cardiovascular system enters a state of balance. That pace is simple. 5 seconds inhale, 5 seconds exhale. No holding, no force. Just a smooth rhythm. This equals about 6 breaths per minute. When you breathe like this for 5 to 10 minutes, your heart and lungs synchronize. your stress hormones drop, your blood pressure gradually comes down. Think of this as long-term training for your nervous system. Not a quick fix, but a deep reset. Do it twice a day, morning and evening. Consistency here is everything. Now, the third technique might feel a bit unusual at first, but it's incredibly powerful. It's called alternate nostril breathing, and it works by balancing both sides of your nervous system. Here's how. Sit upright. Close your right nostril with your thumb. Inhale slowly through your left nostril. Now close the left nostril. Open the right and exhale through the right. Then inhale through the right. Close it and exhale through the left. That's one cycle. Repeat this for about 3 to 4 minutes. This technique is especially useful during stress spikes, when you feel anxious, when your heart is racing, or when your blood pressure suddenly rises. It helps bring your system back into balance quickly. Now here's something very important. Don't rely only on how you feel. Track your numbers. Take your blood pressure before and after these exercises. Write it down. Do this consistently for 2 weeks. Most people notice something surprising. Even after a single session, readings can drop by 5 to 10 points. And over time, your baseline begins to shift. That's where the real benefit is. Even a small reduction, sustained over months, can significantly lower your risk of stroke and heart disease. Now let's be clear. These techniques do not replace medication. They support it. They fill the gap that medication alone cannot. So how do you actually fit this into your daily life? Keep it simple. Morning, before you even get out of bed. 2 minutes of slow breathing. Afternoon or evening. 4 cycles of the 4-7-8 method. And during stress, use alternate nostril breathing. That's it. No complicated routines. No special equipment, just your breath. Your body already knows how to heal. It just needs the right signals. And your breath is one of the most powerful signals you have. So here's what I want you to do right now. If you have a blood pressure monitor nearby, take a reading. Then try the 4-7-8 method. Take another reading. Look at the difference. That difference is proof. Proof that your body is not working against you. It's waiting for you to work with it. If you found this helpful, comment below and tell me which technique you'll try first. And share this with someone who needs it, especially someone managing blood pressure. Because sometimes the simplest tools are the most powerful. Take care of your heart. You've carried it this far, and it still has a long journey ahead.